Hello everyone and welcome again to the Doctor Show. I'm Dr. Zahra Jumaili here, and again we're going to talk about anything that is medical and biology related. So today's topic is actually important for everyone who's doing sports. Yes, we're going to talk about the 3 most common sports injuries and what do we do to prevent them, what do we do to treat them when they happen. First of all, please stay careful. Please do not overexhaust yourself. Please always stay hydrated and always have your efficient food and your enough exercise. But do not overdo the exercise. That's what we ever need to do. So number 1 problem is we're going to talk about is the sprains. When you sprain your ankle, when you sprain any joint, usually it's the most common thing is an ankle. When you suddenly out of nowhere you see someone fallen and they sprained their ankle. What happens when you sprain your ankle when the range of movement of the joint is way above the normal range? So something happens and they sprain. Why does it happen? Usually because of someone trips, falls, if someone actually, when they're doing sports, they overstep their step, they overdo their sprain. So eventually what will happen, it will be above range of movement and it will be severe amount of pain. Usually it's severe amount of pain. What will happen immediately, you need to take a rest and look at your joint. You will have inflammation, swelling, redness, tenderness, and you will could have it for a few days to up to a few months. You need to go to a doctor immediately and get an x-ray done on it to make sure that your bones are not broken. You need to make sure that your ligaments, the ligaments are basically the end of the muscles. They actually get attached to the bones, and they're the ones, the ropes to attach the muscle to the bone. So usually around every joint we have a lot of tendons. So we need to make sure your tendons are fine. So let's leave the strains for a while and go to the sprains for a while and go to something called a strain. All right, if we sprained our ankle, we have something called a strain which is your muscles. Purely your muscles, suddenly out of nowhere, they make like this mound, this turning down. You overdo the use of your muscles. That's why if you actually do a lot of sports, if you do sudden movements, your body is not used to it, your muscles are not used to it, so your muscles will actually, it's a sprain in the muscles, all right? So this strain is actually something not okay to have. It's a bit dangerous because it takes few days until it actually goes back to its position. So when it happens, it's actually also severe pain. When it happens, it's basically a lot of inflammation and swelling and redness and tenderness. Usually happens in the quadriceps muscle, which is the front of the thigh, and usually happens in sports injuries as well when people are running a lot and they're doing sudden movements and they're overdoing their movements. So what do we do to actually treat it? The first thing we ever do is to massage it, to keep on massaging it and go to you shouldn't go to a doctor immediately, honestly, because it's not that worrying, but you should always massage it and put those ointments, that muscle relaxant, for us for a while to make sure the muscle relaxes and opens up, and this big bulk of the mound in your body goes away. The last thing we're going to talk about is something different than the strain, which is a muscle cramp. Usually when you see a football player, suddenly out of nowhere he just falls and they're trying to massage his feet because out of nowhere his muscle ran out of nutrition and hydration. It's mainly because of dehydration. That's why sometimes when you wake up at night and you have this muscle out of nowhere cramped because of dehydration. Most of the dehydration that happens because we don't get enough water, or we get water, but we do 2 hours exercise, that this 1 cup of water is not enough for this amount of exercise. So we need to regularly keep ourselves hydrated, and we regularly take a lot of minerals as well, like potassium and sodium and all of that, and dehydration is not always just water, it's also minerals and potassium and sodium and all of that. So all of that is actually because the lack of it makes dehydration. So even sports player, they usually see that their water contains more potassium and sodium and all of that because dehydration is very dangerous. And there is this always this misconception about eat a banana, you'll be fine. Eat some pickles, you'll be fine. No matter how many bananas you eat, bananas are good, you should eat them anyway, but they will not take the cramps away. They will not take the cramps away because you need to get rehydrated, you need to relax the muscle, you need to massage it, and after a while it will be back on itself. It could take up to 48 hours. It depends on the severity of the cramp. But now we need to know what is the treatment. The first thing we do if any of these three things happen, especially the ankle sprain, you need to do something called RICE, R-I-C-E. RICE, it stands for rest, ice, compress, and elevate. The first R is rest. The second this happens, do you keep on going on your match? The show must go on? No, the show must not go on. You should go home and rest. All right, so you should go home and rest your ankle or your muscle and all of that, because more movement will become more severity and more dangerous, so you need to stop it. Number 2 is ice. You put a lot of ice on it because ice helps in the inflammation, in the blood supply, it helps in the pain, it helps with everything. So you need to put something cold on top of it, but you should put intervals. Put it and take it off and then put it again, so you would not have any problems and you would not have more pain and more, and do not put direct ice on it. You should put it in a cover, or you should put like any frozen like vegetables do you have, all right? Not directly icing. All right, number 3 is compress. I need to compress my wrist, my ankle, my whatever joint there is, and the compression should not be too tight because it will close the circulation, the arteries and veins, and it should not be too loose because we wouldn't do anything. So we need to compress it and make sure this compression does not hurt you, does not make you uncomfortable. It's just comfortable enough, because the compression helps the swelling to go away, helps the pain, helps the inflammation to go away easier, and you need to change the compression once in a while, not to be always compressed. The last thing is elevate. If it's your ankle, you need to elevate it above the level of your heart. All right, so when you need to elevate it, it makes the gravity works its magic, makes the gravity, makes all the swelling goes away one step at a time. Please always make sure to remember the RICE. You can do them alone, you can do them without going to a doctor, but if everything took too long, you should go to a doctor and make sure you're perfectly fine. Please stay safe, please stay hydrated. Please, when you're doing sports, I know you might get excited out of nowhere, but take care of yourself, because those injuries could take up to 3 to 5 to 6 months until they actually heal. So be safe, stay hydrated, and always eat healthy and exercise. Thank you for watching, and I'll see you guys next Tuesday. Have a good day.